Understanding angina, a pain in the chest. Angina is a medical term for chest pain caused by reduced blood flow to the heart muscle. Imagine your heart is a powerful engine, constantly working to pump blood throughout your body. Just like any engine, your heart needs a steady supply of fuel and oxygen to function properly. Angina occurs when the coronary arteries, the blood vessels responsible for supplying the heart with oxygen-rich blood, become narrowed or blocked. This blockage restricts blood flow to the heart muscle, leading to pain or discomfort in the chest. Angina is a serious condition that should never be ignored. It's a warning sign that your heart is not receiving enough oxygen and could be at risk of damage. If you experience any symptoms of angina, it's crucial to seek medical attention immediately. Remember, angina pain is your body's way of telling you something is wrong. Don't hesitate to call for help if you experience chest pain, especially if it's new, unexplained, or accompanied by other concerning symptoms. The warning signs, recognizing angina symptoms. Angina typically manifests as chest pain or discomfort, often described as a tightness, pressure, squeezing, or burning sensation. The pain may radiate to other areas of the body, such as the arms, especially the left arm, shoulders, neck, jaw, back, or upper abdomen. While chest pain is the hallmark symptom of angina, it's essential to be aware that not everyone experiences it in the same way. Some individuals may have atypical symptoms, such as shortness of breath, nausea, fatigue, or lightheadedness. The intensity and duration of angina pain can vary depending on the severity of the underlying coronary artery disease. Some people only experience mild discomfort, while others have severe, debilitating pain. If you experience any sudden or unusual chest pain, it's crucial to seek immediate medical attention. Don't try to diagnose yourself or wait to see if the pain goes away. Early intervention is key to preventing heart damage and potentially life-threatening complications. When the heart lacks oxygen, the root of angina. Angina is caused by coronary artery disease where plaque builds up inside the arteries, narrowing them and reducing blood flow. This buildup, known as atherosclerosis, can begin in early adulthood. As plaque accumulates, it hardens and restricts blood flow like a clogged pipe. During physical activity or stress, the narrowed arteries can't supply enough blood, leading to angina. Understanding the cause of your angina is essential for effective treatment. Stable angina, predictable and manageable pain. Stable angina is the most common type of angina. It typically occurs during physical activity or emotional stress when the heart demands more oxygen. The pain is usually predictable, meaning it happens under similar circumstances, and subsides with rest or medication. Think of stable angina like a traffic jam on your daily commute. When traffic is light, you can reach your destination without any problems. However, during rush hour, the increased volume of cars on the road can slow you down or even bring you to a standstill. Similarly, with stable angina, your heart can function adequately under normal circumstances. However, when the heart needs to work harder, the narrowed coronary arteries can't keep up with the demand, leading to chest pain. Stable angina is often managed with medication and lifestyle changes. By reducing risk factors and improving heart health, many people with stable angina can lead active and fulfilling lives. Section 5. Unstable angina, a medical emergency. Unstable angina is a more serious form of angina that requires immediate medical attention. It occurs when plaque ruptures inside a coronary artery, forming a blood clot that partially or completely blocks blood flow to the heart muscle. Unlike stable angina, unstable angina is unpredictable and can occur at any time, even at rest. The pain is typically more severe, lasts longer, and doesn't improve with rest or medication. Imagine a major accident on a highway that completely blocks all lanes of traffic. This sudden and unexpected blockage causes a major disruption, preventing any vehicles from passing. Similarly, unstable angina represents a critical blockage in a coronary artery, severely compromising blood flow to the heart muscle. This is a life-threatening situation that requires immediate medical intervention to restore blood flow and prevent heart damage. If you experience any symptoms of unstable angina, such as sudden severe chest pain that doesn't improve with rest, call 911 or your local emergency number immediately. Variant angina, a different kind of chest pain. Variant angina, or Prinzmetal's angina, is caused by a temporary spasm of a coronary artery. This spasm reduces blood flow to the heart muscle, causing chest pain. Unlike stable angina, variant angina often occurs at rest and may wake you up at night. The pain can be severe but usually subsides quickly with medication. Triggers include smoking, cold weather, stress, and certain medications. Treatment involves medication to prevent spasms and manage symptoms. Section 7. Diagnosing angina. Tests to uncover the cause. Diagnosing angina typically involves a combination of medical history review, physical examination, and diagnostic tests. Your doctor will ask about your symptoms, risk factors, and family history of heart disease. During the physical exam, your doctor will listen to your heart and lungs, check your blood pressure and pulse, and look for any signs of heart problems. To confirm the diagnosis and determine the severity of your condition, your doctor may recommend one or more diagnostic tests. An electrocardiogram, or EKG, is a simple, painless test that records the electrical activity of your heart. It can help detect any abnormalities in your heart rhythm or blood flow. A stress test, performed while you exercise or take medication to simulate exercise, can show how well your heart functions under stress. Other tests, such as an echocardiogram, coronary angiography, or cardiac CT scan, may be recommended to provide more detailed images of your heart and coronary arteries, helping your doctor identify any blockages or other abnormalities. Section 8. Treating angina, restoring blood flow to the heart. The goal of angina treatment is to relieve symptoms, improve heart function, and prevent future cardiac events, such as heart attack or stroke. Treatment options may include lifestyle changes, medications, and in some cases, procedures or surgery. Medications play a crucial role in managing angina. Nitrates, such as nitroglycerin, are often prescribed to relax and widen the coronary arteries, improving blood flow to the heart muscle. Aspirin, a blood thinner, may be recommended to prevent blood clots from forming in the arteries. Other medications, such as beta blockers, calcium channel blockers, and ACE inhibitors, may be prescribed to lower blood pressure, slow the heart rate, and reduce the heart's workload, all of which can help prevent angina. In some cases, procedures or surgery may be necessary to improve blood flow to the heart muscle. Angioplasty, a minimally invasive procedure that uses a balloon to open blocked arteries, or coronary artery bypass surgery, which creates a detour around blocked arteries, may be recommended for certain patients. Lifestyle changes are essential for managing and preventing angina. Adopting heart-healthy habits can improve your overall health and reduce heart disease risk. Quitting smoking is crucial for heart health. Smoking damages arteries and raises blood pressure, contributing to angina. A heart-healthy diet lowers cholesterol, blood pressure, and weight. Regular physical activity is vital for heart health. Aim for 30 minutes of moderate exercise most days. Choose activities you enjoy, like walking, swimming, or dancing. Managing stress is important for heart health. Cope with stress through exercise, relaxation, or connecting with loved ones. Section 10. Living with angina. Managing symptoms and reducing risks. Living with angina requires ongoing management and lifestyle adjustments to control symptoms and reduce the risk of complications. By working closely with your healthcare provider and adhering to your treatment plan, you can live a full and active life. It's essential to take your medications as prescribed and to report any side effects or changes in your symptoms to your doctor. Regular checkups and follow-up appointments are crucial for monitoring your condition and making any necessary adjustments to your treatment plan. Be prepared to manage angina episodes if they occur. Carry your nitroglycerin medication with you at all times and know how to use it correctly. Rest and avoid exertion until the pain subsides. Educate yourself about angina, its causes, triggers, and treatment options. This knowledge will empower you to make informed decisions about your health and to advocate for yourself. Section 11. Seeking medical attention. Don't ignore chest pain. Chest pain is always a serious symptom that should never be ignored. If you experience any sudden or unexplained chest pain, especially if it's severe, lasts for more than a few minutes, or is accompanied by other concerning symptoms, such as shortness of breath, nausea, sweating, or dizziness, call 911 or your local emergency number immediately. Early intervention is crucial for preventing heart damage and potentially life-threatening complications. Remember, time is muscle when it comes to heart attacks. The sooner you receive medical attention, the better your chances of a positive outcome. Don't hesitate to seek medical attention even if you're not sure if your chest pain is serious. It's always better to err on the side of caution. Your doctor can determine the cause of your pain and recommend the appropriate treatment.